Hey everybody, I'm joined here today with Dr. Abovian over at Vita Skin Beauty Center. You can find them at vitaskinbeautycenter.com. And so we're here to talk about their treatments for ED, along with some of the main causes and questions patients usually have. So doctor, thanks so much for joining us today. Really appreciate it.
Thank you very much. Happy to be here.
Yeah, absolutely. And I wanted to start off by asking about your experience working with these patients and what got you, into these treatments and being able to help them with this.
Well, I have been trained as a family physician, so I've been seeing very many types of patients in my experience. Many of them did start complaining about erectile dysfunction as they age, and technically, as I became more interested in aesthetics, sexual clinic became one of my major interests,
Mhm.
as my clients were mostly interested in some sort of help, some sort of rejuvenation. Now, I do have a lot of data on my website that explains how, people get this problem as they age, as they become older. But I'll go with you as you ask my questions.
Okay, perfect. Yeah, so what are really some of the main reasons why somebody might have ED?
So the ED basically is developing based on two reasons. First of all, as we age, we start losing blood flow to the penis. So the blood vessels become closed, they atrophy, and we lose the blood flow. And then the second thing happens as we age is losing collagen. So as you lose collagen, you actually end up losing the wrapping around the penis, that firm wrap. And so you basically can't even hold the pressure. So the problem is twofold. You don't have blood flow and you can't keep the pressure in to maintain the erection. And then actually additional stuff that I see very often is the diabetes, the smoking. Those are the major issues that actually contribute to the development of these issues.
Okay. And so with the treatments that you have, are those specifically aimed at solving those two issues, the blood flow and the collagen?
So there are a lot of treatment actually out there, but the main ones that I use is in my practice that I use is the non-surgical and non-invasive procedures that are the shockwave therapy and the PRP or PRF injections into the penis. That those two together actually produce the improvement by basically the shockwave therapy is aimed into the production of new blood vessels called neovascularization. So someone can get new blood flow to the penis, and the PRP or PRF injections basically improves the collagen production inside the penis around the wall in a way to say to keep the pressure.
Mhm. Okay. And I know a lot of patients have tried things like, Viagra and Cialis for their ED, but those can have side effects and they really don't, they're not a long lasting solution. Are the ones that you provide more sustainable and long lasting?
Yeah, so that's the main benefit of my program that I use is to do the treatment enough to give them a more long-lasting improvement and benefit. Viagra is or any one of those types of medicines that people use are just a temporary solution for that specific, evening. But shockwave therapy that we use has a program of 12 weeks. And so essentially you come and you get about close to 2,000 shocks around the penis area to develop new blood vessels. So that's a weekly therapy, and then during that period of time you can get several PRP or PRF shots. Now we kind of go for PRF because that's the second generation PRP. It lasts and stimulates and is more powerful than PRP. So we kind of recommend the PRF nowadays. But definitely our treatment has long-lasting benefits. And many people say, okay, how do we kind of check on us? So there's something called shrimp score It's a scoring that is available everywhere, but we have a link on our website. So you can actually, score yourself and see where you are, your baseline. And then we actually test the shrimp score in the beginning, at the 6 weeks, and then at 12 weeks. Now, during the year, you can actually check the shrimp score yourself and see if you have lost any of the erection and you want to do maintenance therapy. You come and get more of a shockwave or another shot. That is also possible to do. And again, the links are on our website. But yes, it is one of those things that would require some maintenance therapy.
Mm-hmm. Okay, that's good to know. And how long does it usually take after they do the initial treatments before they start seeing some relief from the ED?
So from what we have seen is that, and what the data suggests, is that there's 50% improvement in their scoring at the 6 weeks after the shockwave therapy. And so we actually give them some rest, sometimes 1 or 2 weeks in between, and then we continue on again another 6 weeks. Now, after that second 6 weeks, the improvement we have seen actually goes up to almost 80%. But the data says that there's 50% improvement at the 6 weeks after shockwave therapy. Now, you may get a P shot or like PRF shot or a penis shot or any of those penis shots with the PRP or PRF within the first 6 weeks, and then get another one within, or 1 or 2, in the next 6 weeks. There's really no data showing how many you should get. But as far as the shockwave therapy, there's really data that shows 12 weeks are recommended, and there's 50% improvement at the 6 week mark.
Okay, that's good to know. Now, do you usually recommend any other treatments, modalities to really get the most out of it? Is there anything that the patients need to do on their end to really make it effective?
So that is technically how much the patient or the client wants to be involved. There's also obviously if there are more kind of desires or interest to participate and do more, than you can. Some of them can use vacuum therapy on their own. That is also shown to be helpful. Some urologists actually recommend combining the vacuum at home for the clients to use. But it's not really something that I recommend everyone. On the other hand, we recommend stopping smoking. We recommend additional herbal supplements that are available out there that we recommend. For example, many of my clients are interested in using ginseng, which increases, some of the nitrous oxide. It technically works similar to what the Cialis or Viagra would do, but in a herbal format. So there are some herbal stuff that I recommend. There's one of the herbal stuff that I actually recommend that gives the prostate a helpful health, like in a way even decreases the size, and also gives many of them confidence in self-confidence. Is the St. John's wort has been really helpful in that. It increases the mood, increases the desire. So combining some herbal products has been really helpful. There's also another herbal product that I have used called Tankot Ali that increases the testosterone. So we have used at least those three. I'm just mentioning here, but there are obviously more stuff that can be used, like the horny goat weed with maca or things like that can be used. As far as the horny goat weed, the interesting thing is that it kind of changes the vision of the client. So like say many in 50s, they say we're not visually stimulated anymore. So the testosterone is low. So some of them want to get a testosterone, but I don't really recommend much testosterone injections due to possibility of prostate enlargement and prostate, side effects with the testosterone injection. Although some urologists would argue on that and say, yeah, testosterone can be injected on, but it can be very addictive as well, the testosterone injections. But the horny goat weed is a herbal product that I have used to stimulate their visual stimulation. If a person is not visually stimulated by their partner, that can be a problem as well. So I combine the herbal substances with, this shockwave and peanut shot treatment to improve their lifestyle. But obviously, there is other options, including testosterone injections, that people can consider.
Okay, yeah, it's good to know that they have the different options that are out there. And I know for a lot of men, they might assume that, ED and some of these symptoms of, low libido are just part of the normal aging process, but it sounds like you're able to restore that for a lot of these patients, right?
So, when you talk about restoring, restoring or restoration is not just one meaning. It is a spectrum of meanings, and restoring some function would be a better way of explaining it, because it's not a complete restoring of function, but reversing, in a way, the progression would be a better way to say. We're able to reverse the progression and improve the functionality. That's a better way to explain.
Sure.
Because restoring means you have a furniture and you just restore the color of the furniture. That's not the case here.
Right, that makes sense. You're really able to stop that process, or at least slow it down and give them
Slow it down,
function
exactly.
back. Okay, that makes sense. And yeah, what would be the best way for patients to get in contact with you if they wanted to come in? Would it just be through the website?
Yeah, so my website is very mobile friendly, and there are text me options, and request a consultation by sending an email, or they can easily text me from the link. It's a secure phone number. They can text me, send me their concerns, issues. That's the easiest way. For my other aesthetic issues, like lasers and rejuvenations, I do a lot of CO2 lasers also in my website, and as well as other stuff. They actually, clients do a photo consultation, meaning they send their face pictures, concerns. But in this case, because the issue is so intimate, that I don't want any photos to be sent, but they can actually write in their text messages whatever concerns they have, and we can discuss, and I can give them a phone number, schedule a consultation with me, or if they want to call our office, obviously they can, have them talk to my front desk, and I will be happy to contact them, call them back, and schedule an appointment.
Okay, perfect.
But all the information is available on the website.
Okay, awesome. And yeah, those are the questions that I had. Was there any last advice or anything you wanted to leave them with if they're, considering these treatments that we talked about?
I just would like to say that we are here, the treatments are available, and definitely we can be helpful in reversing the damage and improving the functionality. And we would like to have a long-lasting relationship with our clients, be able to work through their issues, this issue or other issues. So we're here to help, and so we're here to explain. Like, we're here to hear your concerns, and we're here to deliver the services.
All right, great. Well, yeah, well, thank you so much for taking the time to talk with us today and share the education on those treatments. I really appreciate it.
And lastly, these procedures are done personally by me, and many of our male clients can be comfortable that it will be done by a male provider in a very secure and private medical office environment.
Yeah, that's great to hear. I think that makes them feel a lot more comfortable about that. Definitely. All right. Well, thanks again, Doctor. I appreciate it.